It
Okay.
is not a miracle drug. And this is what I tell every single person. You got to do the work. And they're like, well, I stopped exercising, I stopped watching what I was eating, and I gained the weight back.
Right, right.
So you can't put all the blame on the medication.
Sure.
I mean, they come in and they're like, listen, I'm always tired. I'm taking care of the kids. I'm running around doing this.
Well, sounds like life.
But the thing that people don't realize is testosterone in women is really the main hormone. This is what your lab value is, and this is what you're telling me. Like, I don't feel comfortable starting you on testosterone at this time. Let's try a few other things first.
She is the owner and operator of Elevate Med and Aesthetics. It's a med spa in Plantation, Florida. Welcome, Amy.
Welcome to Two Taps and Friends. Grab your favorite drink, get comfy, and let's dive into another episode of Two Taps and Friends.
Welcome back to Two Taps and Friends. I'm Danny Rosenberg, host of your show. Today I have a very special guest. I've been trying to get on here for a while. I have Amy Iannello. She is the owner and operator of Elevate Med and Aesthetics. It's a med spa in Plantation, Florida. Welcome, Amy.
Thank you.
Welcome.
I'm honored to be here.
No, I'm glad to finally have you on here because these are things that people are talking about. You're doing things every day that people are talking about that not many people know much about. They know what they hear or read, and it's good to have an expert like you on here, and I'm glad you're here. But start off, if you could give an intro about yourself, who you are, where you come from, and how you got into this field.
So my name is Amy Iannello. I'm a physician assistant. I have been for 26 years. Originally from Buffalo, New York. Go Bills. Sorry, guys.
How about the Sabres?
Okay, go Panthers for that.
I'm joking. Go ahead.
So I started out my pathway in Buffalo working in cardiac surgery. And then I moved down here to Florida because I couldn't deal with the snow anymore. And then I started doing cardiology here, electrophysiology, got married, had kids, started working in the emergency room, and then COVID hit. COVID was very difficult for all of us in the emergency room.
Right, I imagine.
And I needed something a little bit different. And I've always had a passion for aesthetic medicine, longevity, hormone replacement therapy, those kind of things.
Right.
So that's when I decided to open up a med spa in Plantation, which is where I live, and help the community.
How long have you been doing it? How long has it been open?
We've been open for 3 years.
Right.
I've been kind of dabbling in this for about 10 years.
Oh, wow. And yeah, you have a thriving practice, and it's a lot of people I know go there, and it's just very well known, and you're very well liked. But let's just jump into some of the services that you guys provide that we can give a kind of a background for people to understand it a little bit more. I wanted to start off with, I'll just call it the shot, right? The diet shot, right? The thing that everybody's on. There's names that people recognize.
Right.
But there's different brands. Could you just tell everybody what the two different kinds of shots are and tell us a little bit about it? Like, how does it work and what's the purpose of it?
So I call it medical weight loss management, basically. Okay. And there's a couple of different ones that we have. We call them GLP-1s, which is glycogen-like peptide. It's a peptide. And what it's used, we have semaglutide, tirzepatide, and what we use them for is to kickstart your lifestyle change. Okay. It is not a miracle drug, and this is what I tell every single person. You got to do the work, right? You need to diet, exercise, drink plenty of water, make better food choices.
How does it kickstart? What does it do? Like, what is the... Well, what was it initially for, this shot? Is it I heard diabetes, right?
So it was initially FDA approved for diabetic management of type 2 diabetes.
Okay.
And then they found a lot of people were losing weight from it. And then they got the FDA approval. The first one was obviously Ozempic, which everybody knows.
Right.
And the weight loss one is called Wegovy.
Okay.
So we'll leave it at that.
Right.
And it's a once a week injection. And it suppresses your appetite. It makes you get full faster. It slows down the digestive tract, so you get full faster.
But that's all it does. Like, that's basically. But that's all. When we say it slows down, all it really does is slow down your digestion. Is that a safe statement, or is there other things that it's doing?
So there's other things that it does. So like before you start these shots, you have to do some, labs to kind of see where you're at. And a lot of times I like to look at everybody's hemoglobin A1C to see if they're pre-diabetic, to take a look at the cholesterol and HDL, LDL, triglycerides, those kind of things.
Okay.
And the medication really helps to improve your hemoglobin A1C, and it really helps to also improve your, say, cholesterol, just to put it in layman's terms.
Right.
And it does that by working on the glucose in your system, the insulin sensitivity, and it really does cause that fullness feeling.
Oh.
And then there's certain foods that you don't really want anymore. So it takes care of that sweet cravings. Because especially right now, the holidays are coming, it's
Sure.
Halloween, everybody's eating the candies, candy corn, which I'm a huge person
Me
for.
too. I'm
I
not going
love
through
it.
it today. I'm like, I gotta not eat these, and like, it's gonna be hard. It's gonna be hard tonight
Right.
when all the kids are around. But go ahead. Yeah. So
But you don't have those cravings anymore.
Right.
So it really controls the cravings. It helps you to have smaller portions. And then once you start losing the weight, it really makes you feel a lot better about yourself.
Oh,
So
sure.
not only is the medication used for health purposes, it's also used for mental purposes, really, because then you start to feel better about yourself, right?
Right.
And it's an amazing cycle where you're like, well, now I don't want to grab that donut because I'm losing weight, I'm exercising,
right.
I'm looking better. So your mental health improves as well.
And your motivation. So now, when you say like there's work that needs to, first of all, let's talk about the work you need to do with it, right? So
Right.
I know that I've heard that you need, you said lifestyle changes. So does it require like a strict diet, or when you say that, what do you mean by doing the work? You can tell the viewers a little
So
bit
when
more.
I have people come in for a consultation, we have
Right.
an in-body device.
Okay.
And it measures your total weight, your skeletal muscle mass, and your percent body fat.
Those are a nightmare, those machines. Just so you know, those are the most intimidating
best.
machines in the world. I mean, obviously they're the best, but I'm just saying most
Right.
people dread that.
Because it literally gives you a baseline
Right.
of where you need to start. You know how everybody is so focused on that number on the scale?
Right.
You shouldn't be.
Right.
You really should be paying more attention to your percent body fat because that's what you need for your health purposes. And when I tell people this is not a miracle drug, because if you don't do the work and you come off of it, guess what?
You're going to gain weight. Probably
You're going to gain the weight back.
Or get it back.
Right. You're going to gain it back. So isn't it better to work with the program to eat more protein, not as many carbs, to start exercising, to literally change your life?
Right. And the difference with this is that I think when people are doing because when you diet, normally people tell you eat less carbs, all the stuff that we're saying. But I think
But you
seeing
need carbs.
results so fast, seeing it happen quicker, I think is much more motivating to people, right?
Well, the average weight loss on the medications is about a pound a week.
Okay.
I know you hear things on the radio, oh, you're going to drop 10 pounds in a month. That's not realistic.
Right.
I mean, if you're going to do it the right way, do it the right way. Because then you can come off the medication, you can use it as a maintenance dose, and you've learned how to eat.
Portions.
Now you've
right?
learned, like, hey, I don't need this huge plate of food. I can have half of this.
Right.
You've learned that I need to exercise. And if I exercise, I actually do need carbs,
Right.
because you're going to burn that. You need protein. Protein is what helps with the muscle building.
Right. So it's safe to say that you got to put in the work. You got to diet, but it's like giving an extra oomph, and the results will come quicker than you would be on a straight diet. And what about exercise? You recommend exercising with it as well?
100%.
Right.
Especially, so I have a lot of female clients who are on this, and a lot of the female clients are in their perimenopausal state.
Okay.
And in women, it's very hard to lose weight in your midsection, especially if you're perimenopausal. We hold all of our weight there.
Perimenopause, that just for the layman's, because a lot of us might be dumb with that. That just means premenopause.
Premenopause,
Okay.
right.
And is there a certain age that every woman goes through, or it's different for every woman?
Every woman is different, but menopause is usually in the 50s, and it
Okay.
really depends on like when your mom went through menopause.
Okay.
Some women can start, perimenopausal in their 30s. So it's very dependent on your genetics.
Okay.
But you can't lose the weight in your midsection. And then all of a sudden the weight's going to start creeping up every year. Like, oh, I gained 4 pounds this year. I gained 5 pounds this year. And then all of a sudden you're like, oh my God,
I'm
I gained 30
every way,
pounds.
right?
Like, what the hell happened?
Yeah. That's
So
terrible.
when it comes to exercise, especially for women, you really need to do weightlifting. Not as much cardio, because you see those skinny fat women out there. No
Right.
offense to anybody,
Right.
but
Right.
I used to be a runner, and that's all I did was run. And all of a sudden I'm like, well, I have zero muscle tone.
Right.
So I completely stopped running, and all I do is weightlift.
Well,
And it's not like you have to do heavy weights. You can do light to medium weights, do it 3 to 4 times a week. Even if it's just 30-minute sessions, just get it in.
Right.
And that helps with preventing osteoporosis as well.
Right. So do you recommend this for like, because there's, the people that are obese, right, that are extremely overweight, I think that you'd recommend it for a plethora of reasons, right?
Absolutely.
And they would probably see significant weight drop quicker than maybe someone that needs to lose 5-10 pounds. Is that accurate?
Absolutely.
Right.
Absolutely.
But do you recommend this for people? Like, what is the weight? If someone wants to lose 5 pounds, do you recommend it? What is your thoughts?
If you want to lose 5 pounds and you can't do it, sure, try it for a month.
Sure.
Because there's other benefits that come with the medication as
Right,
well. I mean,
right.
because there's anti-inflammatory factors. They're seeing that it helps with cognitive function, Alzheimer's. Like they're seeing so many benefits of it.
Right.
It's when you decrease your visceral fat, it's decreasing the estrogen. So there's a lot of cancers out there that are estrogen based, right? Breast cancer, huge thing. Breast Cancer Awareness Month in October.
Right.
So there's a lot of different benefits to the medication besides just weight loss.
Right. So, and okay, let's talk about some of the side effects, because I've heard people that, because I know people that are are taking, what are the 2 different kinds of shots? Let's talk about that first.
Okay, so you have the semaglutide, which is Ozempic for diabetes, Wegovy for weight loss.
Okay.
And then you have tirzepatide, which is Mounjaro for diabetes, and Zepbound for weight loss.
And what are the differences really? Just what you said, or what is the difference between the 2?
Between the 2 medications?
The 2 different shots,
So
like what differentiates them?
The Ozempic and Wegovy, it's basically the same thing.
Okay.
It's just one is for weight loss, the other one is for diabetes.
Okay.
And it's also like, because you can get it approved for your insurance based on your BMI.
Okay.
I've heard it's very difficult to get that done, unfortunately.
Right.
When we should be in preventative medicine
Sure. But
here
that's
in the
not what this
United
country
States.
does. Right.
No.
Band-aid medicine, right?
Right.
Right.
And then the tirzepatide, which is the Mounjaro, and the Zepbound is what we call a GLP-2. So it's a newer medication. It got the FDA approval status much later. People say with that one, sometimes it works better for you. You have less side effects. So some of the most common side
Yeah, I was
effects,
just going to ask you about side effects.
right,
That's a good
is
segue.
nausea,
Okay.
nausea, vomiting, and so we prescribe Zofran for that
Okay.
to help to prevent that. The other side effects can be like headache, fatigue, dizziness, but you have to understand this medication lowers your blood sugar. So if you don't have a steady state of a good blood sugar in your system, when it plummets, you're going to feel the effects, the fatigue, the dizziness, the nausea. You're going to have a really hard time. So I always recommend to people to eat every 3 hours, small meals, which contain a good amount of protein and a little bit of carbs.
Okay. And as far as, so with those side, is there any other major side effects, like digestive things I've heard of or anything like that?
So they have found that because it does slow down your digestive tract, that there can be a risk of like constipation, bowel obstruction. So if you don't really take care of that constipation, you kind of need to pay attention. So when you go for any type of surgery, the anesthesia people will tell you to stop the medication 3 weeks prior.
Okay.
To make sure that there's nothing still in your system, and they've also had some sort of link to medullary thyroid cancer. So if anybody has a history of thyroid cancer, the medication is contraindicated. The medication can also affect the pancreas and gallbladder. So those are things you kind of have to monitor and go over what those symptoms are with the patient before you prescribe it.
So you're doing all this lab work. When you have a patient, you're doing that. You're constantly doing lab work and all this kind of stuff. Now, these symptoms, do they tend to like go away? Is it something like at the beginning you feel it, or sometimes you're going to recurringly have these symptoms, like nausea, for example?
So everybody's different. You can have nausea in the beginning and then it can go away. You can have nausea the entire time.
Right.
So that's why I give the Zofran. And sometimes you really get the nausea because you have nothing in your system. You're just not eating because you have no appetite.
Right, right.
So sometimes if you put something in your system, you're not as nauseous.
Right. And as far as long-term effects, is there anything long-term that they're finding of it? I mean, obviously it's a rather
It's a
newer
new
medication.
Right.
But,
So it's kind of hard to discuss the long-term effects at this time.
right. And now long-term, as far as, is it okay for people to continuously take it, or is it one of these things that you want to try to eventually come off of this medication?
So remember, it's a diabetic medication.
Sure.
And it's not like your diabetes is going to go away.
Right.
So those people are on it for life.
So it's designed to be on, for someone to be on it for life.
Right.
Or potentially could
So the way I describe it for people who, like, let's say they met their weight loss goal.
Right.
You can do a maintenance dose every other week. You can do it every 3 weeks. You can lower your dose. There's a lot of different things. I don't recommend just coming off immediately, but kind of doing like a weaning process.
Right. And there's people I've heard, I mean, I'm just hearing the buzz of like what some negatives are. People say that when they come off of it, they just have this insatiable hunger. Is that true? Or what is your thought on that?
Some
What is your
people do
experience
and
with
some
that?
people don't. You
Right.
know, like I've had people who have lost the weight, they met their goal, they did the maintenance dose, they've been off for a year, and then they call me and they come back.
Right.
And I'm like, what happened? And they're like, well, I stopped exercising, I stopped watching what I was eating, and I gained the weight back.
Right. Right.
So you can't put all the blame on the medication.
Sure.
I mean, you have to take some sort of accountability.
Right. Right. Okay. So those are the two effects. And then the other major thing that I think that you're doing, what do you think is the other busiest part of your practice that you guys are doing? Is it the hormone replacement?
It's hormones.
Well, can you talk about that a little bit? Because people know a little bit about it, but like whatever, you tell me what you see most in your.
So
in your,
I do hormone
practice.
replacement for men and women.
Right.
And it is based on your labs and based on your symptoms. So
And that's testosterone, or there's different things that you're doing, looking for.
so I look at a lot of different things. It's
Okay.
not just one lab.
Okay.
But the thing that people don't realize is testosterone in women is really the main hormone.
That's a lot of people don't realize. Like
No.
that is a new thing to me. I learned that not long ago. So the people know women estrogen, men testosterone, right? Could you
Exactly.
break that down a little bit?
I
for
mean, that's how
everybody?
we were brought up, you
Right.
know, estrogen for women, testosterone for men.
Right.
So, you know, we're all born with a certain amount of testosterone. As we age, it goes down for
Right.
men and women both. I think men are more open about their needing of testosterone because, you know, the main thing is libido
Right.
in men.
Right.
You know, their workouts are not as good. They're not recovering as fast.
Right.
You know, and there's more to it. It's also fatigue, it's brain fog, it's holding that weight in your midsection. It's
Right.
all the same kind of thing. And men and women feel the way. And I have a lot of women who come to me and they're like, you know, something's different. I'm not the same. I can't lose weight. I'm exercising, eating the same, and I'm not losing any weight. I'm always tired. And, you know, it's usually women in their 40s to 50s. So I'm like, all right, let's do some blood work. Let's see what's going on. You know, when you look at the FSH, LH, which measures where you are in your menstrual cycle system,
Okay.
and if you're menopause, it tells you exactly what lab values, what you are if you're in menopause. And then you look at the estrogen and testosterone. Not only is it the total testosterone, but the free testosterone. And the free testosterone is what is actually circulating in your system. And then, you know, there's different lab values for men and women both. And I'll look at the lab value and then I'll have the conversation with, you know, either men or women. Tell me what's going on. What are your symptoms? And then I tell them, like, hey, you are a candidate for hormone replacement therapy.
Right.
And there's a couple of different ones you can do. You can do the cream, you can do the injectables, you can do pellets. Now some of the companies have something called liposomal, which is oral, which you kind of keep in the mouth for like 30 to 60 seconds and let it absorb that way.
Wow. And now with that, is that something, once you start doing that, is that something you have to maintain? You have to, like, because you're kind of like, I don't want to say artificially, but you're now giving a boost to your system.
So, I mean, it is kind of artificial.
Right.
So we call it like exogenous testosterone.
Okay.
So if your testosterone is already low, it's going to stay low.
Like it doesn't, there's no, I mean, it's probably, I heard that you can you build it up, or it's not very effective in the building it up
So there's certain
without
supplements you
help?
can take to build it up, right?
Right.
Like one of the most important things to look at is your vitamin D level.
Right.
So if your vitamin D level is low, then it naturally brings down your testosterone level. So I always recommend, you know, people to take vitamin D. And I have some men in their 20s who I'm like, you know, don't start taking testosterone because then you're stuck. You know, you still
Right.
want to
You
have
can take it
kids.
forever, right?
So we can put them on vitamin D. You know, like they have supplements out now, different vitamins of naturally building your testosterone. Does it really work? Maybe a little bit. You can also start enclomifid, which will also help to work on the, you know, testes and stimulate the testosterone, and it talks to the brain, the pituitary,
Right.
to stimulate more testosterone. That's only going to get you to a point. You know, if you really do start the exogenous testosterone, you're kind of stuck. I mean, honestly,
Right. You're stuck doing it. And then, because if you come off, what happens? You crash?
you crash.
Like an immediate crash to where you were, or is it a gradual decline back
It's
to
a
where
gradual decline because your body wasn't used to making it anymore.
Right.
It had help. And then you go down. Like I've had a couple of men who have stopped taking the testosterone and then they come back to me and they're like, I can't function. This is absolutely horrible. I am
Right.
miserable
when they stop, right?
when I stop.
So I mean, yeah, that's and the guys in their 20s that are coming, are they already low? Is there a situation where these guys are low, or they're just trying to get more testosterone?
Right. They're not low enough. Like I won't start them on testosterone.
Right.
I'm like, listen, this, because you just can't go by the lab value. You have to go by their symptoms and what's
Right.
going on.
You have to look at the patient.
Right. And I'm
Yeah.
like, this is what your lab value is, and this is what you're telling me. Like, I don't feel comfortable starting you on testosterone at this time.
Right.
Let's try a few other things first.
So you turn a lot of people away with that. I mean, if they don't meet your criteria, you're just going to turn them away, right?
I will.
Right, 100%. That's good.
I'm just not going to put you on medication because you want
You
it.
can be stuck on it for the rest of your life. I mean, listen, if you need it, you need it, right?
Right, exactly.
But for women, tell, because it's such a thing, most people don't even know it's testosterone. Does it affect the same thing in women, libido and all that, or is it a little bit different?
Yes.
Really?
So
Well, the guys are going to take that now and like, I'm buying
Yeah,
my
this is my
wife
wife.
testosterone, like
So
we
you
all know
have
what
to
the
do-
Christmas and Hanukkah gifts will be this year,
you
We'll share on Instagram. We'll share her address. Just stop by. There's there's a window, a drive-through. You don't even have to show your face. No, I'm
Right.
joking. Well, go ahead.
So you have to get baseline labs first
Okay.
before we can figure out exactly what you need. And for the women, it's interesting because they don't really know they need testosterone.
Right.
I mean, they come in and they're like, listen, I'm always tired. I'm taking care of the kids. I'm running around doing this.
Sounds like life.
And it is
Right,
life,
yeah.
right? You're like, my skin is dry. I can't lose weight. Like there's a lot of complaints and you're like, well, I guess this is what it is.
Right.
Until really the hot flashes kick in. And you can have a hot flash during the day. You can have it at night. You're not sleeping. You're urinating more often.
Oh God.
And it takes women to get to that point to be like, something's wrong.
Right.
When it actually started a lot sooner, you just didn't realize because you thought, well, this is life.
Right.
You can go to your OBGYN. You can ask for lab work. Back in the day, they used to put women on SSRIs, like a Paxil, like, here, this is what you need to
We know those
help with
are-
those hot flashes. But that's not, getting to the root cause. That's not treating the root cause. It's just slapping a Band-Aid on it.
Right.
So let's figure out what the root cause is.
Right.
And then when I started asking women about their libido, I'm like, hey, how's your libido? Well, by the time I get, to bed and after
Right.
I've made dinner, cleaned up, put the kids to bed, drove everybody on, that's the last thing I want. And I'm like, so how is that working in your marriage? Well, maybe,
It's not.
right, they're like maybe, once a week or once every 2 weeks and, it's work. So you don't really realize as a female how it's affecting your marriage either.
Right. Right.
Because I think a lot of men, they push more and women are like, this is a job, leave me alone, I'm tired.
Right. Right.
So it takes a lot for a female to ask for help, honestly,
Right.
in those areas.
Especially, yeah. I mean, it's just new to so many people. I mean, I've never thought that. I never heard that. You connect testosterone with men with the libido, and the working out and seeing results or recovery more, right? So,
I think with
interesting.
women, it's expected. Like it's expected for women not to want to have sex as much as men.
right, seems normal.
Right.
Right, right. Well, I'm glad you're solving that problem for the
I'm
world.
doing my best.
Great. We'll get the population rising again. No. So so what do you think the next thing is? The next like busiest thing? Would you say it's like the Botox and that kind of stuff? The inject. What? I mean, tell a little bit what.
So I actually think the next best thing or next hottest thing that's happening right now are peptides.
Oh yeah, talk
because
about the peptides.
People want to live longer, right?
Right.
Like there's a huge thing out there now with, anti-aging, longevity,
Sure.
wellness, biohacking. I mean, you hear those terms all over the place now.
But it's hard to determine if it's real or not with all the stuff you see.
There's the cold plunge, the sauna,
Right.
the difference between the hot and cold. And I really think it does help your stress level and decrease your cortisol level to a point. And then we have these peptides that are available that nobody really knows about.
Yeah. What are they?
There's so many.
Okay.
Like BPC 157, it's used for anti-inflammatory reasons. It helps to repair muscle soft tissues, tendons. So any sports injuries, like I think a lot of the athletes are doing these kind of things that nobody really knew about. There's different types of that. It could be oral, injectable, there's strips, there's so many different types. There's other peptides, which is like CJC, Tesamorelin, Semorelin.
What do those do? Those for different
So
things?
these all stimulate growth hormone. That's what all the peptides do.
Okay.
And those ones in particular help with muscle mass and lean muscle mass and giving you energy.
And that's natural. It's a natural thing. Like
it's an amino acid
kickstarts
chain.
So you're kickstarting something that you have in your body anyway.
Yes.
So it's not like the dark steroid that everybody's worried about.
It's not like
Right.
the BPC 157.
Right.
We actually have that in our gut naturally.
Okay.
So you just don't produce enough.
Are they injectables, or are they like how do you take the peptides?
So there's different ways. You
Okay.
can do an injectable, which is 5 days on, 2 days off. The liposomal, again, which is the oral, which you let sit in your mouth for 30 to 60
It
seconds.
dissolves, right?
And there's strips. And it's, again, all of them are 5 days on, 2 days off. You can do it for 2 to 3 months, and then you need to take a month off. You got to give your body a break because it does stimulate growth hormone.
Okay. And so you're working out with this too as well? Is it?
If you want the best results, work out with it.
Wow. Okay. So even if you don't work out with it, would you say it's burning fat and like you're leaning up? Is that even possible?
It's probably possible, but if you want better results, I would definitely recommend working out. Plus, it's good for your mental health.
Right. So 100%. So you take this 5 days a week, you take a break on the weekends.
Yeah, so I'm, simple. Monday through Friday, I take Saturday, Sunday off.
Take Saturday, Sunday, and you work out the whole time, and you see like you how quick before you see results? Because that's what people, what people are going to look for.
So it takes time.
Quick fixes, right? People want quick fix.
Of course, that's
Right.
our society today.
Right.
But it takes time. Like it took me 2 years to get to where I am today. But I was consistent.
Right.
And I was consistent with, working out, eating better. I did the weight loss in the beginning, lost my weight, I came off.
Right.
But I was consistent with the way I'm eating. I work out, drink a lot of water,
Right.
really don't drink a lot of alcohol, kind of do better things. I do the cold plunge, the infrared sauna.
Yeah, alcohol is just a killer.
It is.
It's just
Because
a
you feel like
killer.
crap the next
I
day,
had a
too.
few drinks last night at the game, and I'm suffering. And I regret
Exactly.
it. I don't know what the hell I needed it
But
for.
that's okay. I can treat that too because we have all those IVs.
Right. I mean, so that's
Hangover
another-
IV, immunity boost IV, especially now with everybody getting the flu. We're seeing a ton of flus.
Right.
And, there's like also recovery IV. You can do stem cells, exosomes, all of those things too. There's a lot out there that people, as you're right, they don't know.
Right. And there like significant symptoms, side effects, not symptoms, side effects from peptides. Like, is there something that people like? Do people get nauseous or anything like that on them?
So sometimes you can have a little nausea associated with it.
Okay.
At the injection site, you can have a rash. You can have like a histamine response.
Initially, or just all the time? Then you won't. Be
You can
able to
have it
take
initially. I tell people to take antihistamines if that happens. And I
Okay.
really monitor everybody, like people who are on like the weight loss, the peptides. Like I give everybody my cell phone number. Like, hey, if there's an issue, call me day or night. Like let's talk it out.
Right. Okay. So you recommend for people? You recommend this service for health? You think it's a recommended thing?
For anti-aging,
Anti-aging.
health, and longevity.
Okay.
Yes.
Now, what about some of the other anti-aging? Like, I don't even know like the Botox and that. Do you do a lot of that as well?
Botox
Is
is
it
amazing.
Botox, or is that the name for it? Is that the medical name? Is that a brand name?
So you have a box of tissues
Yeah.
and you call it Kleenex.
Okay, so it's a name brand.
Right. It's a name
Okay,
brand.
all right.
Botox has been around the longest.
Okay.
There's so many other what we call they're neurotoxins out
Okay.
on the market. Some are newer. Botox is the oldest because it was the first one that had the FDA approval. Neurotoxins are amazing. They're amazing to really help freeze the muscles, decrease the muscle movement, and it softens the face. It gives you more of a refreshing look.
Right.
There's things you can do to treat Botox for medical issues, such as TMJ. You inject the masseters.
Right. I heard that.
People are treating it for migraines where you can inject in the temples, the forehead area, the back of the neck, those kind of things.
Right.
And then there's also for people who have urinary incontinence that you can use Botox in the bladder.
Really?
Yep.
Wow. So I mean, I've never used. I mean, honestly, I've never used it, and you probably could look at me and tell that I've never used it.
Well, listen, we can do some Botox.
Yeah, you know.
Yeah, so for you guys, I call it Botox.
So talk to me. I mean, it was known to like I always think of women doing it, right? But guys are using this. Would you say as much or more?
I have a ton of men who use it.
I have a couple of people that I know that are walking by me all of a sudden, and sometimes you can. Sometimes you can really tell. How does that? Is that doing too much of it? You know, because a lot of times I have no idea. The person will tell me that they've used it. I'm like, wow.
So it depends on what you want, and I'll talk to the person. I'm like, do you want to be frozen or do you want to have some movement and look natural? Seriously.
I know some people.
But you'd be surprised how many people are like, freeze me up.
Really?
Yes.
Do you think that some of it, like, I don't know, I saw, like, I was in Beverly Hills or Hollywood, that whole area. We were there. I was visiting, and one of my friends is a big actor over there, and I met him for lunch. I'll meet him for lunch when I'm there. And as I walked in, like, I see all these, like, young, really pretty girls, right?
Sure.
But their faces look so, like, and I'm thinking, like, these girls are gorgeous. Why are they doing it? And I asked him, like, what the hell's going on over here? This was like 15 years ago. Now it's everywhere, right? And he's like, he said he thinks it's a little bit, it becomes like a mental sickness for some people though, right?
It does. I mean, it could be body dysmorphia.
That's
for sure.
Right?
But you have that in all aspects, not just in the Botox. You get it in the fillers. Like I've had women come to me, oh, can you do filler? And I'm like, you already have filler in your lip. Oh, but I need more and I need bigger. And I'm like, no.
Like, so you do tell people no.
I do.
And you warn them. Do you warn them? Because I told you you start to look like a Star Wars character, right?
I'm like, you know, those duck lips?
Yeah, that kills me.
I'm like, but you look fake. Like, these treatments should be used to enhance your natural beauty.
Right.
Don't look weird. Like, you know how they, Madonna looked, her face was all distorted because somebody kept filling her face. Like, stop.
Right. And the fillers, how does that work? Did you just inject what? What are you injecting? Fat?
It's hyaluronic acid.
Okay. And is that just sits there? And does it deplete after time? How does it work?
So that's a really good question.
Right.
Because they would say it lasts 6 to 8 months, and now they're noticing that this hyaluronic acid that should be broken down by your body actually stays there. So they've done ultrasounds on people who have had filler 10 years ago, and it is still there.
Wow.
And filler migrates. So people have to understand, as good as your injector is, sometimes the filler migrates and there's just not a lot you can do about it, especially in the lips because we use this muscle all the time.
Right. So is that something that you do? Is a lot of people come into you for doing it?
The most common filler is lip filler and cheek filler.
Cheek filler. Yeah, okay, that makes sense.
Because you have volume loss. Like as women and men both age, we all have volume loss. You have skin laxity and the face kind of just falls. Basically.
So the proper way to use it, I don't know if you could say something like that, but in your eyes, the proper way to use it would be just a periodic thing if you feel like maybe you just want to freshen up or how do you recommend using it, I guess is my question.
So when I have people come in and I do a consultation, I literally ask them, I give them a mirror. I'm like, when you look at yourself, what is it that you want improvement on?
Right.
What do you see? And you wouldn't believe how many people come to me and they're like, can you do this? And I'm like, no, that's surgery, you know, but
hold on, let me tie something. Let me see if we can work. We can rig something up, right?
They do have the threads, but I don't do the threads.
What is the threads? Oh my God, that sounds like some Texas Chainsaw Massacre thing.
It's literally like just like the suture, like you use when you get sewed up.
Suture.
No, so it's like using a barb and you literally pull it back.
And it just stays? Is it visible?
No, they say it dissolves,
Okay.
but then you go talk to a plastic surgeon and they're like, if I have to do a facelift on that, this is like my worst nightmare.
Really?
Yeah.
Wow. So
just be natural. Natural is good. Like it's okay to age,
right?
But just age naturally and beautifully with some enhancement that you look natural.
Right. So that's what you recommend saying. So like, in other words, make it so it looks natural. Right?
Right.
More
like
than
you don't want anyone to know how many syringes you have in your face, do you?
Oh my goodness, no. But I sat with someone not long ago, and their face was just like here, and they were like this, and I'm like, what do you say to people that get to that point, and you're there, and they're like insisting? You just put your foot down?
No, I don't. I won't do it.
Right.
Because don't forget that's also my name associated with that.
Right.
So I won't. I don't feel comfortable.
Right.
You know, and I've had people say, hey, can you dissolve it? And I'm like, listen, I'll dissolve whatever you have. But then you need to wait 3 weeks. And I said, let's do this accordingly.
Right. And how do you dissolve it? What do you do with that? What is that process?
It's so uncomfortable.
Oh my God, what is it? Do you like shoot acid in the phone? I'm so unsophisticated with this.
No, it's called hyaluronidase.
Okay.
And it's literally used to dissolve this hyaluronic acid filler, and it burns.
Oh my God, it sounds like it burns.
It burns. It's uncomfortable.
And then,
I mean, but sometimes you have to do it, so you just do it.
when you go back to the exact normal state, there's always going to be some like leftover. Or is there disfigurement sometimes from it if it's really?
I mean,
bad?
there can be disfigurement. That's
Right.
why you have to use more. And
Right.
when you actually do dissolve filler, it is hard because the filler migrates, so you kind of don't know exactly where it is. Like you have an idea, but you just kind of have to do what's best, and you may have to come back more and have more done.
Right. Are guys using injectables?
Not as
They're
frequently.
using more of the Botox, like the
Right.
right.
I mean,
okay.
because, listen, as men
Unless a
age,
guy wants luscious lips,
that I've never seen. Never.
I've seen it.
But like, as men age, they get, as we say, distinguished. They're like fine wine. As women
Right.
age, I think there's so much more in society
Right.
that it's harder for women.
Yeah, that makes sense. Right. I think they get the brunt end of it. People are more
Of course.
judgmental, more like scrutinizing, because
Look at social media. I mean, look
Yeah.
at Kris Jenner. I mean, she looks amazing, but she had like some serious plastic surgery done.
right.
But she looks amazing. And she's like, what, 60 something years old?
Right. Right. Was there any other service that like you do that people don't know about that you want people to hear about, or anything else that we haven't covered? We did the peptides. We did
Right.
that. We did.
So we also do stem cells and exosomes,
Okay.
which Governor DeSantis, passed a law in July of this year that in the state of Florida, we can do that. And stem cells and exosomes are used for anti-aging and longevity. It could be used in the treatment of joint pain. It can be used for aesthetics topically. It can be used for hair growth. So for men, we do a lot of hair restoration
Really?
where we do the exosomes, which are specific for the hair, and we microneedle them into the scalp.
Wow. So I didn't even know you did that there.
Oh, yeah. And it causes, like, your hair grows. Like, it's amazing.
Wow.
I mean, there's a lot of things we have to do with it. Make sure you are taking certain supplements, make sure you have a shower head filter, but it's better than flying to Turkey.
Oh my God. And it's effective. You're seeing people that.
It's effective,
Wow.
yes.
That's impressive. That's awesome.
I mean, we do like the typical stuff, hair laser removal, CO2 lasers, regular microneedling, regular facials, those kind of things.
Okay.
But
Well,
it's a great business, and I love helping people. And it's not just helping people on the outside, it's helping people from the inside out.
right. You're doing the full gambit over there.
But that's how you should be, inside out. Supplements, do all of the labs. You can check for like mold toxicity, heavy metals, inflammatory markers of certain food that you should not be taking. It's just, you got to start from the inside out.
Right. Right. Well, thank you for coming on. We're kind of out of
Well,
time
thank
now,
you.
but I appreciate you coming on and educating people. And
I
like,
appreciate it.
I hope to bring you back again. If
I would
there's
love
any,
it.
Like news, or keep everybody up to date on what's happening, what's out there, what's good, what's not good, what not to do, what to do.
Exactly.
But thank you for coming on. And to all listening viewers, you can find Amy. She has Elevate, like I said, Med and Aesthetics. It's in Plantation. She's on Instagram. We're going to cross-reference and promote all of this stuff as well, so you get the chance to see what they do.
Yes, thank you.
And Amy, thank you so much for coming on, and I hope to have you again soon.
All right, thanks. I appreciate it.
Thank you so much. And to all my listeners and viewers, thank you for listening and watching the Two Taps and Friends. Please like and subscribe to the channel. Like I say, if you like and subscribe to the channel, it gives us more outreach. We're able to bring more amazing guests like Amy on. You can find us on YouTube. We're on Spotify. We're on Apple Podcasts, iHeartRadio. We're everywhere. Thank you all for listening. We love you all. We'll see you next time. Cut! We're good.